Hi friends and comrades, I am Nithish Mohan from SFI Gujarat. At first, I thank the Comrade channel who had provided me an opportunity to share my views on the Gujarat matter. When the states such as Kerala are loosening the lockdown criteria, the so-called Gujarat's main city, Ahmedabad, with the highest number of positive cases, had announced that till 15 May there will be complete lockdown in Ahmedabad and only milk and medicines will be available. Each and every cereal shop, that is ration shop, and the vegetable vendor will also be not available. Will be not available. Due to which people were gathering in large numbers in every store to reserve their stocks day before yesterday. More than 100 people gathered around every store and a long queue was formed. Traffic was such that it seemed like days before the lockdowns have come back. This happened on May 6th. All of a sudden, the Municipal Commissioner of Ahmedabad, Vijay Nehra, and the Jayanti Ravi were forced to go on leave, who had taken stringent measures to control COVID-19. Jayanti Ravi, the IAS officers, used to do daily press briefing regarding the Gujarat's the situational analysis of the Gujarat. As we know, yesterday Ahmedabad had reported 275 COVID-19 positive cases, and 23 deaths were registered yesterday. And in all, if we will talk, in all today, Ahmedabad had 4,991 cases, that is around 5,000, and 321 deaths so far. And the case of Gujarat in all, yesterday the case registered were 387 and total deaths were 29. Till 6th April, Gujarat positioned below in the state-wise rank for number of positive cases of COVID-19. But now the complete scenario has been changed with an upsurge on the number of positive cases. The first positive case was identified on March 19. And during those days, the state was not having any proper action plan to combat the pandemic, which manifests the irresponsible behavior of the state government. The state government started to act only after the first phase of the lockdown, which was declared by the Prime Minister. And that is after the Janata curfew. On the other side of it, Kerala had formed its high-level action committee to combat the corona on January 25th itself. And the first positive case of COVID-19 was reported on January 30th. Till end of March, Kerala was on first or the second position in state-wise ranking of COVID-19. And it succeeded to go down on 13th in the list right now. As we know, the Director General of WHO, Dr. Tedros Adhanom had also called for a global emergency, which is the highest level of emergency in the world on January 30th itself. The interesting point is that on that day, there were just 82 cases out of China. Globally, there were just 82 cases out of China globally, from which 10 cases were from Europe, and there were 0 cases from Latin America and the African countries. Gujarat government was too much weak into understand the pandemic and to diagnose the looming disaster. The state budget was presented in the Gujarat Legislature Assembly on February 26 itself. But the state government was not serious about the widely spreading pandemic, and it had not uttered a single word regarding the COVID-19 or the pandemic in the assembly. The days in between had also shown many big extravagant shows such as Namaste Trump, which had costed 1 crore of rupees for the state government, which was held on 24 at Ahmedabad to receive the President of the US, that is Donald Trump, by the PM Modi himself. During this event, the Ahmedabad Municipal Corporation had constructed big walls to hide the poverty of Ahmedabad. If that money were invested in the public health system, then also it might be fruitful. According to the official figures, the Namaste Trump event had shown up a crowd of approx 1.25 lakh people, that is 1,25,000 people. This audience mainly consisted of school students, factory laborers, government employees, teachers, scheme workers, etc. The government administration had not left a single stone unturned to reach this figure. The density was too much high that the mobile towers were installed overnight. Thus, the preventive measures which must be taken during the period of global emergency were not taken. As the one of the main thing we have to understand that Gujarat today has one of the highest fatality rates, that is death rates, the highest fatality rates, and the lowest recovery rate for the COVID-19 positive patients. Surprisingly, Gujarat, which we consider as a model state, which the Prime Minister Modi considered it's a model state, which the media considered it as a model state, during the 2014 Lok Sabha election, to elect Chief Minister of Gujarat as the Prime Minister, the recovery rate of Gujarat is too much low. Today, the recovery rate in Gujarat is just only 22.6%, which is below the national average. And if we will compare it with Kerala, the Kerala has the recovery rate of 94.2%. And for Gujarat, it is just only 22.6%. And in the similar way, if we will see the fatality rate or the death rate of Gujarat is 5.9%, which is near about 6%, and for Kerala it is 0.7%. It was not new for the state. We can see that this shows us the position of the public health sector in the state and its capability to fight the pandemic. Recently, just a month ago, that is March 2020, Nitin Patel, Deputy CM of Gujarat, revealed the data on infant mortality rate. According to the data, near about 15,000 newborn children had died out of 72,000 in the mega cities of Gujarat, in the public hospitals of the mega cities of Gujarat. The maximum number of newborn deaths were registered in Ahmedabad, which was 34.2%. And right now also we can just see the Ahmedabad district has the largest number of COVID-19 cases. Today on May 8th, one of the news came in front of us. That's the paramedical staff from the government hospital of Vadgam. Actually, Vadgam has also one more special thing, that it is the birthplace of Prime Minister Narendra Modi. In that government hospital of Vadgam, the paramedical staff had protested against the Gujarat state government of not providing proper PPE kits and masks for them. The large number of health professionals are fearing death due to insufficient number of protective gears. A video was circulated in the social media where near about 25 COVID-19 positive patients from Ahmedabad were waiting for the admission in the civil hospital. The footage described the patients were requesting CM and PM about the ill behaviors of the state. The only one who was registering the patient details and their concerns about the treatment. And just 10 to 15 days before, the Ahmedabad civil, a inpatient from the Ahmedabad civil hospital had also had spread a video. In that video, the inpatient was complaining about the quality of the food which they were providing and the breakfast which they were not providing. As we know that the civil hospital of Ahmedabad is also the largest public hospital in Asia. As we can see in the Kerala model that there were more than 1400 plus community kitchens and 20,000 plus labor camps in Kerala. But the Gujarat government had not set up a similar mechanism to help the poor and the needy. Most of the days, the community kitchens and 20,000 plus labor camps. But Gujarat government had not established a similar mechanisms to the poor and the needy. Most of the days we had seen protests by the guest laborers in Gujarat, and the major district was Surat for that protest. The main issue behind it was due to the lack of proper shelter and the food. According to one data, NGOs has provided near about 90% food kits to the needy people. And in the case of government had only provided 10%. The helpline provided by the AMC went off after a day of its launch. When the guest laborers were going to their home via train, the state government, Gujarat state government had not provided a single bottle of water or food for their journey hours. A click was viral in the social media by the Ahmedabad Mirror. This shows the Gujarat state government's Gujarat state government's work on the migrant laborers. Recently, when I called one of my friends who was infected with COVID-19 in Ahmedabad, told that the public health sector was worse, due to which he had to be admitted in the paid private hospital. In that hospital also, proper health care were not provided. The food which was provided to them were also not proper. On the other hand, the Gujarat state government had advertised across and secondary and on the same section, the Gujarat state government had advertised across the state that the private hospital will be providing with the help of huge hoardings and newspaper advertisement. They had advertised that the private hospital will be providing free treatment for the COVID-19 patients, and on the other side, AMC had permitted 3 private hospitals of Ahmedabad for the treatment of corona affected patients, from which one of the hospital, Sterling Hospital name, is levying a deposit of 8.5 lakh from the patients infected by the COVID-19. And one of the hospital, HCG, had told in the media that a minimum of 5 to 7 lakh rupees will be costed for the treatment of COVID-19 patients. One of the patient from Surat had to pay a bill of rupees 5.88 lakh, near about 6 lakh, for the treatment of COVID-19. That bill was viral in the social media during that time. The AMC, there was also a decision of the Ahmedabad Municipal Corporation to start a care center, to start a paid care center at a 5-star hotel also. Like that, many things are there. At first, we know that extensive testing, contact tracing, mitigation and treatment is the only way to save this state from the pandemic. The Gujarat must follow the steps taken by the Kerala government to combat the COVID-19. Eventually, the hollow structure of the Gujarat model has to be concretized aptly by the well-planned communist-led Kerala model, and to be an example to the entire world. I am concluding my talk. Actually, we have to understand this hollow structure of the Gujarat model, and we have to work on it. Okay, why this structure had become hollow? Not a single media, not a single national media is talking about the condition going on in Gujarat. They have more focus on Maharashtra or the non-BJP led government states, the state with non-BJP led government. Actually, the real condition of Gujarat also should also be highlighted. At last, I am concluding. Thank you.